right, we're going to talk about how to put on sterile gloves. Later on, you're going to have a student demonstration of putting on sterile gloves as part of the dry sterile dressing. So you're going to have started with clean hands. So I've already washed my hands and dried my hands using the proper technique, and now I'm ready to put on my gloves. Now open the package carefully, take them out, and you're allowed to touch this part. What you don't want to touch is the gloves themselves. You can open this here. The paper is going to want to fold back on itself, so I find it's easier if you just kind of do a little half fold that way and a little half fold this way. And now I'm going to open right here. The outer inch is safe to touch, but anything inside the inner inch is not okay. So I'm left-handed, so I kind of do this backwards. I like to put my glove on my left hand first. Generally, we put the glove on our dominant hand first. So the first glove, I'm going to kind of step to the side and pick it up like a crane. Notice it wants to stick to the paper. It's okay to put one finger down to lift that glove up. I can touch this cuff in the inside of the glove so I can get a good grip on it. And then I want to step back so that I'm not over the top of my sterile field. And I want to pull this glove on. These ones have long cuffs, not all of them do. I'll show you what to do with that in a minute. My second glove, once again, I can put a finger down on that outer inch. Now my second glove, this is a sterile glove, so now I'm going to want to take a hold of the glove from inside the cuff. See how I'm holding it there? Okay, so I'm inside the cuff, step back. Once again, I'm going to hold my hands up and away. Did the fingers touch? Pull down? Okay. You're paying attention to those wiggly fingers. You don't want them to touch your skin. So if you hold your hand straight up, sometimes they fold in half and they touch your skin. So I'm going to pay attention to that. I'm going to keep this thumb out. I'm having a little bit more trouble, but that's okay. Once this is like this, I can now take my fingers here to pull that cuff down. Yours may not have quite as long of a cuff. But the main thing, notice I let it snap down. You don't try to fiddle with them and fix them because you don't want your fingers to touch your skin because your skin is not sterile. Now I have sterile gloves and we're ready to do a procedure.